Hi, my name is Erika Fields. I'm a registered nurse with the Webster County Health Unit. Today we're going to discuss dispensing medication to children. At one time or another, all of us have had to give our children medication, whether it's for a fever or for an infection that they have. Nearly 7,000 children every year are treated in emergency rooms for medication errors. One of the most common medications that they see is Tylenol or acetaminophen, or Advil Motrin, which is also known as ibuprofen. Those are two of the most commonly given drugs to children. They're frequently given. The one thing that can make those a little complicated is they do come in different concentrations. And they might also be combined in with other medications. For instance, you might have a cold medicine that also has Tylenol in it. So you would never want to give additional Tylenol because that would be double dosing that child with Tylenol. Even though those medications are both very common and safe, there can be serious complications if a child is given an incorrect dose. So we're going to move on to actually dispensing our medication. The first thing you would want to do is wash your hands. You always want to practice good hand hygiene when you're administering medication. And then you would want to think about your 5 rights. Your right patient or your right child, right medication, right dose, right time, and right route. With the dose, it's always important to read the manufacturer's drug facts on the back of the bottle or the insert that comes with it in the box. And if, like for instance, this medication is Tylenol, if the child is under 2, it says ask a doctor. And you want to be sure that you always do that. Your pediatrician should have correct dosing for children under the age of 2 for medications like acetaminophen and ibuprofen. With our right route, this medication is pretty obvious that it's going to be given orally, and we're going to use a cup or a spoon or a syringe to give this. Where you might run into some problems are medication like eardrops and eye drops because they are packaged very similar and look very similar. So you just always want to double check that you're putting the medication in the designated area that it's supposed to go to. After our 5 rights, we're going to use our medication cup. It's very important that you always use the medication dispensing device that comes with the product, whether it's packaged with it in the box or if it's one the pharmacy dispenses with a prescription medication. One thing that's very important when you do pour a medication is you want to pour it in your container and say, I'm going to pour 1 milliliter of this. I need to get down eye level with that medication cup and make sure that it is indeed at the correct level so that I'm not giving them too much or too little. It's very important to explain to the child why you're giving the medication, even if it's a very small child. You want to let them know that it's to help them feel better. Don't ever call medication candy. We don't ever want to confuse children with candy and medication. That could cause them to get too curious about medications. And on another note, you always want to keep medications up, away from children, preferably in a locked cabinet so they don't have any access to them. So once you give the child the medication, if they happen to spit it out or vomit it, you don't ever want to give them another dose because you don't know how much of it they've actually retained, unless you've been advised by a physician to give them another dose. If you're giving medication frequently or multiple medications, it's a good idea to write down the medication and what time that you're giving it. I know oftentimes we're giving Tylenol or ibuprofen several times during the night, and it can be confusing, especially if you haven't had a lot of sleep taking care of that sick child. So just jot it down with the time and how much you gave. Back on the subject of keeping all medications out of reach, if a child does ever accidentally ingest medication that they should not have, or if you think they've been given the wrong dose, it's always important to be aware of your local poison control number. The number for this area is 1-800-222-1222. Always keep that number handy. Another good thing that we can all do, since most of us have cell phones or smartphones right now, is the Poison Control Center actually has an application that you can download from the App Store or the Google Play Store and place right on your phone, where you have quick access to their telephone number and some other helpful information on preventing poisonings in children. Be healthy, be safe. These are your health hints from the Webster County Health Unit.